Polk County's Indigent Healthcare Division, or IHC, administers the county's healthcare safety net program funded by the sales surtax. Coming up on Polk Place, we'll discuss all the facets of the program. Make sure you stick around. Hello and welcome to Polk Place. I'm Brian Lacey, and joining us in studio, Leslyn Diaz. She's the outreach specialist for the Polk County Indigent Healthcare Plan. How you doing?
Good morning. Thank you for having me. I'm fine, thank you. How are you doing?
Doing great. Welcome to the show. First time on the show talking
Yes,
a little bit about the program. We know that you're with the Polk County Indigent Healthcare Division, and I want to talk to you a little bit. Tell me a little bit about some of your jobs with Polk County, if you could.
Okay, firstly, I started as a temp during 1 year as an eligibility specialist for the Polk HealthCare Plan. And after that, I was moved on as a county employee during 2 years as a case manager, 2 years plus. Currently, I'm the outreach specialist for the Polk HealthCare Plan.
Well, let's talk a little bit about the Polk HealthCare Plan. What exactly is it?
Well, the Polk HealthCare Plan is a service that's offered through the Board of County Commissioners for the residents of Polk County. And it provides access to healthcare coverage for the persons who have no healthcare, who are not eligible for Medicaid or Medicare, medically needy share of costs, or any other kind of health insurance.
If you could, talk to me about the importance of having a plan like this for our residents of Polk County.
Now, this is super important, I would say, because, I would compare wealth to health, and a lot of persons are in a position due to illnesses that they're unable to work. They're in the process of probably getting their disability. They're unable to get that during a period of time. So this is very, very handy, actually life-saving for some folks, because it allows them the opportunity to be seen by a primary care doctor.
We've heard what the plan is and obviously stated how important it is. Who's eligible for it?
Now, to be eligible for the Polk HealthCare Plan, firstly, you have to be a citizen of the United States or a legal permanent resident. And you have to be a full-time resident of Polk County also. And as I mentioned earlier, you cannot have access to any other available services, whether it's Medicare or Medicaid.
Now, we've talked a little bit of who's eligible for it. Let's talk about some of the things that they need as far as documentation to become eligible. What are some of the things that in the determining process?
Yes, there are a number of documents that each individual that's applying would have to present, and that would be a state ID or a driver's license with a Polk County address. We need to have a social security card. In addition to that, we need a second proof of residence. It could be either an electric bill, a utility bill. It could be their rental, their mortgage, and they also need to provide proof of assets, proof of income for those who may have an income. Those are some of the documents that are required, and that's across the board. There may be individual cases that require further documentation.
Let's talk a little bit about how the plan functions.
The plan functions in this way. Once the person applies, the individual applies, they would be assigned a case manager. That case manager would go through the documentation that's presented, would call them and do a phone interview if they cannot do an in-person interview to process the case. And once they are approved, they would be assigned a primary care physician of their choice. They're given the list of doctors that accept the Polk HealthCare Plan. Once they're available and they've been approved, they are on that plan. After that, the primary care physician can give them referrals to specialists as needed. It also provides services for them, not only to be seen by the primary care doctor, but they can also have their medications filled by prescriptions once it's on the list that is covered by the Polk HealthCare Plan.
What are some of the things other that are covered also?
Yes, we have quite a number of services covered. Apart from, as I mentioned, being able to have visits to their primary care doctor, they are also going to be able to have their routine checkups. They're going to have urgent care. Emergency care is also available. There's in-hospital services, outpatient services as well. They can have their lab tests done, MRIs, etc.
How long does the plan last?
The plan actually, when they're approved up front generally for 1 year, but it's renewable after that time if they still need to be on the plan.
One of the things that we heard in the beginning is it's funded through a surtax. Talk to me a little bit about that and how often that will come back for the voters to vote on it.
It is done through the half-cent sales surtax, and it's voted in by the citizens of Polk County or the residents of Polk County, and it is managed through the indigent HealthCare.
Leslyn, we have just a little bit of time left. What I want you to do is inform the residents of Polk County about the importance of having this plan and supporting this plan for those that need it the most.
Okay. Definitely, I would encourage you, if you think you might be eligible for this program, or if you know someone who is eligible for the program, do not hesitate to give us a call to try to get on the plan, because as I said, I've had persons sitting in my office when I worked as a case manager that said to me, this plan saved my life. And we need to have compassion for those who are in a position that's not the same as ours. They're in a position where they're vulnerable at this time due to their economic situation or a health crisis they're going through. And this is very, very important. There's no amount of words that can bring across how important it is to have health care at your access when you most need it, when you are sick. So I would encourage everyone not to hesitate to get the word around about the importance of this plan. We are privileged to live in Polk County having such a program. A lot of places doesn't have any service like this, so it is a privilege.
I want to thank you for coming on and informing us about the plan. And anytime that any changes come about, anything comes about, come back and see me again real soon, will you please?
I sure will, and thank you very much for having me here today.
While the Polk HealthCare Plan is not insurance, it is a way for qualifying individuals to get health care. The Indigent HealthCare Plan manages a provider network for the health care plan that includes primary care and specialty care, physicians, urgent care centers, and 5 area hospitals. Sponsored services include primary and specialty care services, routine diagnostic testing, lab, radiology, hospital inpatient, outpatient, and emergency services. Because the Polk HealthCare Plan is not insurance, participants have no annual deductibles and no claim forms. Most services require a low copayment, which is collected by the provider. You must be a Polk County resident to be eligible for the Polk HealthCare Plan. You may request a member handbook or submit questions concerning your eligibility to the Polk HealthCare Plan by emailing PHP eligibility at polk-county.net or give them a call at 863-533-1111. Did we get it?